Methadone is a drug that was originally developed by the Nazis in Germany, and when the United States went in, we confiscated the patents and the production abilities. It's a fantastic anti-pain medication. It blocks it's a synthetic opiate, and it's used very successfully to treat long-term pain. But when I've done a review of methadone, when you ask about heroin, they describe the methadone issue as the most politically polarizing issue out there regarding drug substance abuse and so on. It's not. Nowadays it's marijuana, especially in California. But what methadone does for people who don't know is you have all these heroin addicts, and they, instead of using heroin, dirty needles with the increase in HIV transmission, what they do is they give you methadone. So you go to the clinic and you take the little pill or you drink the liquid. And that methadone lasts you for 24 hours. And if you show yourself a good enough patient, sometimes they'll give you an at-home dose, and you can go once a week and check in at the clinic. You get evaluated. They take levels. They check your urine, and they say, okay, this person's off heroin. They're not using dirty needles. They're not turning tricks for the heroin. They're not buying. And the big thing about, in terms of criminality with heroin users, is they do a lot of property crimes because they develop what's called a habit. So they say, when you evaluate these folks, the first thing you say is, what's your habit? And they'll say, oh, my habit's $40. My habit is $80. And they describe their habits in terms of what the street cost is for the various for what their particular needs are for the day. Well, you find out what that is. You give them the methadone, and the argument is they can do very well. They can go back to society. They can function. They can be the person they would have been but for the heroin use. Right now, the latest estimates on methadone use is $13 a day for maintaining treatment of methadone or heroin addicts. If you compare that to incarceration, of course, methadone maintenance is much more effective. Right now, there's an estimated 810,000 heroin addicts in the United States, but only about 20%, that is about 250,000, less than 250,000, 200,000 or so, avail themselves to this methadone maintenance treatment. So we have about 200,000 people in this country who are receiving free, if they're not paying for it for themselves, and chances are they're not. It's usually Medicaid, and in this state it's called Medi-Cal. It's usually Medi-Cal funded, and the costs are anywhere from $50 to $300 a week. So when you talk to patients and they say, oh, this is free, I get my methadone free, it's not free. It's costing everybody vis-a-vis taxes and taking from the general fund. That could go to other issues, including detox for the person to be off permanently, or education or what have you. So those are the issues. There's people for it. There's been economic studies that have proven that people on maintenance methadone treatment reduce their heroin use by 70%, and the benefit to cost ratio done by medical economists show a 4-to-1 ratio. For every dollar spent, $4 is saved if the person was incarcerated or kept going through various detox places. One of the things on the methadone, just my final thoughts on it, is that methadone works too well. That's the problem with it. It keeps people maintained, and it keeps them on the path. But it also, the double-edged sword here, is it keeps them away from the destination. And the destination is sobriety and to be off of the medication.
That was exactly what I was thinking.
That's what you were implying earlier.
I know. It is not working.
What I think the best policy would be is if we had, and some clinics do have this, by the way, Kim, is the best policy is that you're in a maintenance program and there's a forced reduction of methadone use over time, a tapering that's used.
The reduction sounds much better than maintenance,
to get these folks off.
Yes.
There's no reason to continue for life, nor should there be a requirement for other people to pay for people who prefer to have this daytime high as they go about life. There's pros and cons for this, and a lot of people who are on methadone say that it saved their lives, and I have patients that say that too, and I don't disagree with them. But, again, it works so well that it helps you on the path, but keeps you away from the destination.
Well, but Dr. Zona, when you say it helps them, does that mean they are now off of it?
No,
or are they
off.
still on maintenance,
They're still on maintenance. And
then I don't see how they have reached their destination.
Because a lot of them, instead of continuing a life of criminality or contracting HIV by using dirty needles or trying to find ways to feed their habit, can actually go in, grab the pill on their way to work, and go and work a full day's work.
Ah, there it is. You mean they are functioning in society as holding down a job?
Some are, some are not.
I see.
Not. Yeah, that's right. So that's where it helps them along the way. But in my opinion, there ought to be a mandatory taper along the way so that these folks are helped. Our toll-free number is 1-888-909-1050, and email is DRZONA, Dr. Zona at zonaprofiles.com.
I sing the song because I love the man. I know that some of you won't understand.